here he is, Dr. Garg. Let's invite him over right now from Boca Raton. Going to da 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 da. Waiting for technology to work. Dr. Garg.
How are you?
It worked. Yeah.
Yes. Okay.
How are you doing, my friend?
I'm doing fantastic. Thank you.
Man, I love that smile. It seems like you're doing well during this quarantine. Are you working hard or hardly working?
I don't know. I'm sleeping the best I've ever slept. I can tell you that.
Well, that's good. You're looking good spirits. I love your smile. And
Thanks.
thank you so much. I know you're one of the busiest guy on planet Earth. So we're going to make sure that we get the most out of this conversation today.
Hey, absolutely.
Well, I've been announcing this for the last week, and it's Friday. Happy Friday to you. We have
happy Friday, yes.
To cover. You're a scientist, you're a published author, and you're a parent. So we will go through, and this is conversations, an audience full of students, parents, colleagues from higher education, entrepreneurs, social entrepreneurs, you name it. So it's more of an inspirational talk, and I know you will inspire thousands of people. Remember, to our viewers, we will house this video as well on YouTube channel JCT4Education. Dr. Garg, how are you today?
Fantastic.
Good?
Yeah.
Okay. So when I was reading, and you have a lot of stories. You're a Gator. You went to University of Florida for chemical engineering.
Yeah, how about that, huh?
How about that? Tell me,
yeah.
You're 16-year-old, and you say, hey, by the way, today I woke up and I want to be a chemical engineer.
I'll tell you, my dad's a physician, and my dad said, you don't want to be a doctor. It's crazy hours. You work nights, you work weekends, you're around on patients. My friends were engineers at 8 to 5, Monday through Friday. That's what you want to be. And that wasn't really what I want to be, but I was good at math and sciences.
Okay.
So he told me that's what I want to be. And so being a good little Indian kid, that's what I did. I did what my dad told me. Okay. And I graduated in engineering, and then I decided that really wasn't what I wanted to be. I got my degree, and then I did want to be a doctor, so that's what I ended up doing. I went back, and it wasn't really going back because I got the bachelor's degree in chemical engineering, and then I got my doctorate actually in dental.
Okay.
Yes.
And did you immediately go into dental school?
I did. Yes, because I knew I was doing it. I was doing good. I was doing good with grades and such, and it was fine. And it would have been a fine career. I just realized it wasn't. It was a career for me. It wasn't something I was passionate about, and it was an undergraduate degree, and I had always contemplated going on for graduate school in any case. So I had a lot of options. I mean, I could go to law school, and I can go to med school, or I could go to dental school, or I could go for a PhD, I could go for, as MBA. I mean, there's so many different possibilities in this country.
Correct.
And this is the path I chose, and I wasn't even sure I was going to be passionate about this, and it turned out I was.
Dr. Garg, when you were doing your college search, what options did you have besides applying to the University of Florida for your undergraduate degree? What else did you look at?
I don't even remember all of them that I applied for and such, but I know the last two that I was considering was Princeton and University of Florida. Okay. And for me, it came down to, my dad's a physician, but a university physician. So he worked at a university his whole career. So his salary was not like what you and I think of as physician salaries, but it was a college professor salary, albeit in a medical school. And so when it came down to it between Princeton and University of Florida, his cost became the deciding factor, University of Florida. Correct. I have no regrets about that. I think it was a phenomenal school. It is a phenomenal school. Was a phenomenal education, is a phenomenal education. And so it wasn't like one was a strong first choice or second choice. Those are the two I narrowed it down to. And then it was a very easy decision from those two for me.
Correct. And right now we have a lot of students deciding. May 1st deadline comes in for deposits. Though a lot of universities, because of the circumstances, they have extended the deposit for a month. So I'm very happy you mentioned that, and a lot of students are looking at loans. And I had this conversation yesterday with a family, and I told the student, listen, you got very good choices, public choice, and please don't push your parents to get all these loans under these circumstances that we're living right now. So once you finish dental school, What happened? I know you work
Well, then
university.
I actually want to get more training. I want to be a surgeon. So I came down to University of Florida, Jackson Memorial Hospital. I did additional training down here. And then I started doing surgery to grow bones and place dental implants and such. So not doing general dentistry fillings and such. And that's what I've been even more passionate about. And now as we talked about before, I've written 8 textbooks on it and give seminars and teach people all over the world on it, and invented a lot of neat devices and neat techniques about it.
When I know, like, you have your surgeon on oral and maxillofacial. So how do you decide to go into that field? I mean, dentists, they have different areas to go through. Why
Yes,
this area
absolutely.
for you?
Yeah, absolutely. And you don't have to. You can be a dentist, or you can do go down different pathways and such. And I think with any of this, it just is following what you enjoy and following what you're good at. And is for me it is kind of interesting because I was doing, in essence, medicine and my engineering background, because I thought what I found from the engineering background was that it taught you to think. Most of my exams in chemical engineering were open book exams. Okay. Because the answer was not in the book. You had to think and solve the problem. I was problem solving. So you could have all the books there, it didn't matter. Whereas in med school, the exams are not open book, because memorizing all the nerves, memorizing all the veins, and memorizing all the blood vessels and such. And if it's open book, then everyone can look everything up. So there's a lot of memorization, but not really problem solving. And I think I was attracted when I graduated to what I do now, is because for surgery, it's a lot of problem solving, because every single surgery, every single patient is unique. And so when you're doing that, you got to think on your feet and problem solve. So it combined my backgrounds. So that training in and of itself has served me well. And my undergraduate, I mean, if you got to apply to med school, you got to get the chemistry anyway. You got to get the math anyway. You got to get the physics anyway. So those requirements I was doing for either route.
Good. Dr. Garg, when one read about yourself, you are a scientist and you're so curious, and you're the father of PRP. Can you explain people what got you into that level of research and what PRP is?
What happened is very number of years ago, we were drawing blood from patients. We'd spin it in a centrifuge, and the red blood cells would go to the bottom. They're the heaviest. The plasma, the lightest, goes to the top. In the middle layer is what's called fibrin and platelets. Like you get a cut on your skin, it's the fibrin and platelets that make that scab. Okay. So we collected the middle of the layer and added to our bone grafts to make our bone graft not scabby but sticky, to hold together better. Okay. And we found it was great for handling, but the bone and soft tissue grew twice as fast, and the bone is twice as dense, twice as hard. Okay. And so we kind of stumbled on the discovery, like, wow. I mean, we're just trying to do something simple, use a simple centrifuge, simple test tubes, and do this to make things sticky, but it's making things grow twice as good. Wow. And once we started publishing that, it took off in maxillofacial surgery and dentistry and periodontics. And then it took off in orthopedic surgery, because they wanted bones to grow faster. And then all of a sudden you have these athletes, and before they would do a surgery, open it up and they're out for the season. And they're paying millions of dollars to sit on the bench, and they don't get the championships. Wow. And now they're injecting these concentrated platelets. Okay. No open surgery, and the body would heal itself. And now the guy could go on and play and get the championships that he was being paid millions of dollars for. Wow. All right. And is kind of earned his keep there. And it took off in orthopedic surgery. Is veterinary medicine, racehorses. Okay. They're very, very expensive, and they get an injury, it doesn't heal. And you got to put them to sleep. And now you inject in their own blood spun like this, and now they heal, and they can go on a race, or they can go on and, to the stud farm and have offspring and such. And so it took off in veterinary medicine, and then took off for plastic surgery. Okay. As instead of using Botox and dermal fillers and such, a lot of it putting in is injecting component of people's own blood. They call it vampire facelift now. And so it took off in every surgical specialty. And now it has become, from that little humble beginning, it became a $40 billion a year industry worldwide. Wow. So PRP is now $40 billion a year. And we didn't patent anything, because nothing to patent is the patient's own blood, just spinning in a centrifuge. And if we patented it, instead of been Skyping in from my home, I'd be Skyping in from my yacht to you right now. I'd be Instagramming in from the yacht if we patented this $40 billion a year industry. But it's so exciting to see all of this is being used for all these different applications. And in the early years, everyone would give us credit, like, hey, can you believe these two, dentists, surgeon guys from University of Miami invented it? And they knew and recognized. And now a lot of folks have forgotten who are the originators of it. And wow. So I don't see those references as often anymore.
So don't worry, we haven't forgotten about it. We know you're one of the fathers, and we're very proud of, actually, I just had one of the senior developers from IB International. She was actually a founder of an amazing project here in the United States 23 years ago, and we kind of came out. But Dr. Garg, so it takes me back. A lot of students are here, they're confused, they're going to schools, economics, business, and then here you are. I mean, this is very encouraging for students in college right now, even for high school students, that you can go for your undergraduate, and from chemical engineering, you can jump into dental and become a scientist.
In this country, it's wonderful like that. Other countries, it's not like that. Other countries, you make a decision in high school, and once you go down a business path, that's it. Once you go an engineering path, that's it. Once you go down a medical,
I think
then we say, hey, why don't you go ahead and cut in front of me in line? Okay, because you're probably more terrified if you're older, as senior citizens, to be in that grocery line. Get them out of there faster.
Correct.
I mean, we can do that type of charity, which costs us nothing.
Correct.
Okay, and so it's not even a money thing. It can be at any level, at any time is a frame.
Well, thank you so much for the work that you're doing through your foundation. $36 million is a lot of money, and thank you. So when I see you, you are the father, the scientist, the author, but you also, like, when I get on that plane, I'm like, I can't wait to see the magazine. And here you are with your seminars. You offer all kinds of seminars around the world. I don't know how you do it. A seminar in Las Vegas, seminar in the Dominican Republic, seminar in Miami. So for the students, the parents, what type of seminars and how often do you have it? And now that we are all with this social distancing, how do you do these seminars from home or from your?
Well, I didn't. You know, with the social distancing, I think for most businesses, most people are earning zero. You know, is there's a few folks, but the vast majority, you know, doctors doing elective surgery earning zero. Is you know, dentist doctors are earning zero. Restaurant owners or restaurant workers zero. Bartenders, bar owners zero. Nail salons zero. Hairdressers zero. You know, most folks are small businesses zero. And even large businesses, airlines are earning zero, hotels are earning zero. There's a small percentage that are earning their normal wages. Government employees are earning normal wages. Maybe university professors are earning normal wages. And there's some people making extra money. You know, the toilet paper companies are making extra money.
Oh my gosh.
The Lysol company, the hand sanitizer company, Perel, they're making extra money. But that's a small fraction that's making extra money, and a small fraction that's making their normal income. I would guess the vast majority of us are making nothing. And so what we're doing is I'm doing my seminars. I'm doing them online on Zoom, and we're doing about 8 hours a day. But it's not generating revenue. I'm doing completely for free. You know, the same seminars that I used to charge thousands and thousands of dollars for, now I'm giving the colleagues completely for free. And I'm not changing the content. I don't say, well, before I used to show these 100 slides, now I'm going to skip every other slide. Okay. And you got to come to my paid seminar when this is over. I'm giving the exact same content as right now at no charge. So I'm doing this, but it's not as a business.
Yes.
Okay. I'm doing it to help the community back. I mean, I know everyone's suffering. You know what? And if I can give you, and I've got this knowledge and I've got this ability to make you a better surgeon and a better clinician and a better doctor, and to give less painful injections to your patients. You know, if I can sit there and through Zoom and through these webinars is teach 20,000 dentists over these couple of days how to give less painful injections, and you know, and better care and faster care for your patients. That's 20,000 lives we can impact positively. And then if you think that each of those 20,000 doctors then works on 1,000 patients a year and they get better care and less painful injections, then directly we help 20,000 doctors, and indirectly we'll help 20 million people get better care and faster care and less painful injections. Wow, that's powerful, all in this 5 weeks. Okay. To help out directly 20,000 people, indirectly 20 million people.
During your seminars, you're teaching implants, PRP. What else? Probably a lot, but just
a lot. Is implants, PRP, like I said, how to give, you know, less painful injections and such. Is how to make things work better and more efficiently, and higher success rate, lower failures.
Dr. Garg, have you thought about during this quarantine, how many thousands of dentists have you empowered and have you coached throughout your career?
Yeah, I haven't thought about it now, but I know the number. You know, in the U.S., there's 100,000 dentists, and 30,000 of them have gone through our, you know, the seminars and courses that are the thousands of dollars of programs. Wow. So 1 in 3 dentists in the country has gone through the program, and the other 2 out of 3, you know, will be going through it in the future. They may have just gotten around to it, but have certainly heard of it.
Well, we're so thankful for your time. I know it costs a lot of money, but we have one question right now. We see on the media, hospitals are full, beds are full. We got a question. What about patients that need chemotherapy? What about patients that they still have an emergency, appendicitis?
So hospitals are not full.
Okay.
They're full of corona patients. That part is full. Okay. But if you say, well, what about the building that does dermatology? You know, to get rid of acne or to lighten your skin, that is empty. That building is empty. Those workers are not coming to work. Those physicians are not coming in except for emergencies, because they want to save the masks and the gloves and any resource they can for the guys on the front lines doing corona. Okay, so the corona portion is packed.
Okay.
Okay, but the rest of the hospital is empty. Plastic surgery, no one's doing, you know, his nose jobs or, you know, his breast implants this week. Okay. They don't want to tie up any resources for that. They want to make them all available for. So the guys that are full, infectious disease specialists are packed.
Okay.
Pulmonologists, packed.
Yes.
Anesthesiologists, packed. Okay.
Yes.
Those are the guys that are packed. The rest of the hospital is actually empty. Okay. So it was a matter of not just hospital beds that they needed people to stay home so they don't have too many patients at a time, but it's a matter of having enough nurses that are doing corona patients, having enough pulmonologists, having enough infectious disease specialists, having those resources. So ask everyone to shut down, decrease the number of cases right now. Those doctors to, give up their personal protection things, is the gloves and masks and such for these guys that are treating it. But anything that's an emergency, if someone calls for a toothache, I go in and see them, and my associates go in and see them. But we're not going to be open for, bondings or veneers or braces or anything. But if someone's got pus, we're going to go in and take care of it. And if a dermatologist has someone that's got a skin cancer or something, they're going to go in and take care of it. But they're not going to take care of skin lightnings and things. Okay. Yeah.
I see a lot of doctors right now giving consultations from home. And I was just, I had a crazy idea. So this is for you, if you invent it or anyone else, is a mutual pattern. So what about creating a phone app with your iPhone or whatever device you have, where you can scan your teeth while you're talking to your doctor? As when we go to the doctor's office, dentist's office, they scan our teeth with this micro camera, and you guys are able to tell on the spot if we have either a cavity, a root canal. Do you see this technology happening? If you want to invent it, I want to be with you.
Well, you know what? I'm doing these kind of things. I mean, what is telemedicine or teledentistry? That's answering phone calls, answering face is time. We've been doing that for years. We just didn't give it a name. Okay. I mean, I've been answering patients' phone calls. Every surgery I ever did, I call the patient that night. Okay. If they got a question, if you don't want to come to the office, call me, text me, email me. I mean, that's what tele is. I think people are trying to call it something telemedicine so they can charge for it.
Yes, correct.
I think that's the difference. Because when we did it for free, we just called it taking care of our patients. I think call it telemedicine, say they can charge for it. The thing is this, okay, in certain things, you can do it, in certain things you can't. Okay. I would love to have a tele-restaurant. Okay. Why? I just had, the food was great. Okay. Take a look. Okay, go ahead and give me a credit card number so I can charge you for my tele-restaurant. That you get to see the food, and I can describe how it smelled to you. Okay, it wouldn't work. I'm going to tell you about my teleconstruction company. I'm going to show you this building going up. You don't get to live in it, but you get to see the building going up. Go ahead and pay me for it.
And then you pay for it.
So it doesn't work in construction. It doesn't work when you're working with your hands. It doesn't work in a restaurant. A tele is, a grocery store. Look, we're going to go down the aisles, okay, and fill up the cart, charge for it. So it would work for things like if you want a lawyer, you could do a legal advice over a tele. Absolutely.
Yes.
An accountant, you could do that as tele. Okay. Online education. You can and they do, and it's big business. Online education, online degrees even. Okay. So it can work in education. It can work in legal. It can work in accounting. There's a number of places it can work. A number of places it can't. Anything that's hands-on, restaurants, okay, surgery, dentistry, nail salon, hair salon, they won't be as tele other than just kind of giving advice and such.
So when do you think you guys will go back to business? When do you foresee that your center?
Well, we're taking care of emergencies, and we always have. We don't want to abandon anyone for emergencies. But as far as for elective procedures, with the team, I had to think of dates, and so our target date is May 15 in Miami. Okay, and that may change. That's three and a half weeks away. Okay. And during that time, we may actually come sooner or go later. I mean, but that's kind of the mindset that the team members have right now. Is May 15, which is actually Friday, so they notify me what May 15 sounds good, so it should be May 18 actually, which is Monday. I'm like, okay, fine, whatever. So middle of May is what we're thinking.
Dr. Garg, we already have a student who I know, Alpha. He is from Zimbabwe. He graduated from Arizona, from University of Arizona. He said it is actually a good idea, the phone app that you can scan your teeth and deliver the results to your doc before you even go there.
Absolutely.
So Alpha, we're counting on you to invent this machine.
Invent that, yes.
Dr. Garg, so we have a question. So your seminars, they require like a practical component.
Yes.
So you cannot teach that practical.
No, so I will I will have to, come out of retirement, come out of this 6-week retirement, this forced 6-week retirement, and actually get back to work.
Okay. Now,
and, yeah,
no, go ahead.
yeah. So because is certain things I could replace my face-to-face with webinars and such, but the hands-on component and practicing, you can't. And who would want to go to a doctor that took courses online and is gonna use them as the first guinea pig patient? I mean, you would want your doctor to have practiced on animal models and plastic models and et cetera, before they do the procedure on you.
Correct.
And so, yeah, that's critical for me.
So the most important topic of this conversation, you're a father, you're a parent, and you have your children, one going to college right now. How's your family doing, and how is that parental portion of you, everybody at home and school at home and everything?
Actually, I've got 3 going in college all simultaneously. And yeah, so it's not easy paying for 3 kids.
No.
And so, and they're doing fine. One is first year undergrad, one is final year undergrad, and one is final year law school. And
okay.
So they're all, in those ages is right there. And the one that was first year undergrad at UCLA we told him to come home. So he's here in Miami. Yes. The one that was final year is undergrad, University of Miami. He's home. The one that's final year law school in DC, we told him to come home. He said he couldn't. I mean, he just had a lot of stuff. And yeah. By the time he potentially could have, and classes went online, because they still had a discussion, by the time classes went online, by then the airlines were shutting down and things, and it just got where it wasn't a good idea to travel. So he said, okay, fine, stay up there. Had he been able to travel about 4 or 5 days earlier, we would have had him here. Okay. And so is for the 2 that are here, it's fantastic. I get to see each one for at least 7 minutes each day. And because they're teenagers, and so that's all they give me, 7 minutes a day, even though I'm home the entire day. But it's still 7 minutes more than I was getting before all of this lockdown.
Well, that's good. That's good.
Yeah, so it's still more than that. Yeah. But it's not like, in my head, I was thinking, wow, we're going to have 4 or 5 hours together. We have a lot of father-son bonding time. Well, maybe if they're 6 years younger or 6 years older, but at this stage.
Are you guys cooking together at least, or?
No, but we're eating for 7 minutes together.
Okay, well, that's good.
Yeah.
Dr. Garg, you're such a visionary. A couple of weeks ago, we had the Associate Dean of Admissions from UCLA, and we were talking about the cost of education. Fiona Reese was here. And what do you forecast? Because you're such a futuristic guy. I've been reading articles about fall enrollment, if that's going to happen, if it's going to happen from home. All the universities, they have different scenarios. Right. What do you think? What do you think is going to happen with next semester for universities particularly?
There's a lot of crises that the country's gone through like this. I was on the front lines at Jackson Hospital when AIDS first emerged, and we had no idea how it was transmitted. I mean, today we know it's blood or semen or saliva borne, but at that time we thought if you got sneezed on from talking, we thought, nobody knew. And things were scary at that time. Maybe not in the lay, consumers, but at the hospital as it was. And we had to change things, and people did suffer, but we came out of it. We came out of it. And it seems like the world was collapsing, but we came out of it. 9/11, I was actually traveling international, and they brought the plane back to the runway and said, you can't travel. Didn't tell us anything. Yes. And then they gave us a hotel room, didn't tell us anything. I turned on the news, I saw that. It felt like the world was crumbling. And we've come out of it. Some things have changed. Now every time I go through at the airport, I got to take my shoes off, scan my shoes, my belt, my wallet. Things have changed, but we've come out of it. And things have changed is after AIDS on how much gloves and masks and such folks use for everything. And things will change, of course, but we're going to come out of this. We're going to come out of this. There's going to be a time when we don't. I mean, even when businesses start is in the next whatever as period of time, is they're not going to go back to full capacity. Restaurants are not going to be as full as they were 3 months ago, and medical offices won't be as full as they were 3 months ago, or nail salons, bars, and they won't be at full capacity. But in 2 years they will be. Okay, and so it's going to be a slow start, but we're all in it together. And if my income is down 30% and the next guy's is down 30%, we're all down 30%. But I think what's going to happen is your income's down 30% or whatever, but your expenses are going to be down as well.
Mm-hmm.
You know, if my income's down 30%, but the airline ticket is 30% less, my hotel is 30% less, is everything costs me 30% less. When we come out of this, our buying power, in essence, will be very similar. Some things won't change. You know, the mortgage company is not going to make it 30% less, of course. That will be the same. But, you know, they got a glut of cars. No one's buying cars now. What's going to happen in 3 months? They're going to be less. Because they got to get rid of those glut. Okay, maybe 30% less. Look what's happened to oil prices. It's gone below $0. They will pay you to take the oil off their hands. This is negative dollars, right?
Yes.
So you know, the gasoline prices will be less. So yes, our incomes will be less, but so will the gasoline prices. So will the price of a car. So will be the price of most things. Some things, no, of course, the mortgage isn't going to change. Is electricity prices may not change, but most things. So our buying power should stay very similar.
Okay. Well, everyone, you've seen Dr. Garg, the scientist, the published author, the parent, the futuristic guy. Dr. Garg, you're amazing. You're inspirational. For the viewers, we're going to house this video on YouTube. And actually, we will actually point your center as well on Instagram. We will put all the links that you have for your center. And Dr. Garg, one last thought before we hang up here this conversation. Any words for all of us before we just go on Happy Friday?
Well, you know what? All I know is every time I want to do something, is I never regretted it. When I changed from engineering, dental to surgery, etc., the only times I regret is when I didn't go for it. Then later I said, I should have done it. So I would tell them, you know what? You have an opportunity. The door's open, go through the door. Okay, don't let those doors close in your face. Go for it.
Thank you, Dr. Garg. And any dental hygiene before we hang up?
Let me see. The scan is clean. Your scan is clean.
Okay. Well, thank you, Dr. Garg. You've been amazing. You're inspirational. How many hours do you sleep a day? Honestly?
I sleep normal like everyone else.
6 hours, 4 hours?
It's a normal, you know, right now it's 8. I can tell you that.
Okay. You look